All right, hello. My name is Christopher Locke. I'm the IBPA Director of Membership and Member Services, and this is the Get to Know Your IBPA Member Benefits webinar series. We want to give people a more in-depth look at these webinars and to see all the amazing benefits we have out there. This one today is really cool. We're covering the Book Industry Health Insurance Partnership. It's a really cool program that we have set up, IBPA, a lot of other different organizations to help you all get the best health insurance for your companies. Today we have presenter, Executive Director of Partnership, Tim McNichols. Hello, sir. How are you?
Oh, great. Thanks. Thanks for having me, Chris. Really
Yeah.
being here today and talking to everybody.
Yeah, and Nora's also here. Just want to say hello.
Hello, everyone.
Yeah.
I'm the account manager here at LIG.
Awesome. So I'm going to disappear and let you all do your thing. Thank you.
Thanks. I'm going to share screen, so let me know if you are seeing everything.
Perfect. You're all good.
Good. So, well, I appreciate everybody joining us today. And today we're going to talk about health insurance. I know this is a question that, well, not necessarily a question, but a topic that a lot of people are interested in or want to know what your solutions are out in the marketplace. And of course, we're here to talk about that today. So we're going to go over, some of those that are available that are real health insurance options today. We do have well, not just a few weeks. We have about 24 days left in the year, something like that, 24 days left in the year. So, some people still need coverage. Others are going to be looking at something for like a January 1st or some type of start date earlier next year. So we're going to kind of go through what's available right now and then what's going to be available in 2023, some of the changes that have happened, some of the things that have developed over the last, really the last year or so, and how that ties into some of the things that have happened over the last few years. Because there has been a lot of changes and a lot of movement within the health insurance industry. And then we're going to talk specifically about what is in this program. So I'll give you the full agenda in a minute. But my name again, Tim McNichols. I'm the Executive Director of Partnerships here at LIG Solutions. We will get into some of the meat of things today, but I wanted to give you just a sampling then again of where we're at. So who is LIG? What are your options? Looking at those benefits that are part of this program, and then we're going to wrap this up with that Q&A as Christopher pointed out. So we'll spend some time with that today. So I wanted to start off with to give you a little understanding of who LIG Solutions is. And this is important, from the standpoint of, how we work and how we work with you. We're a national insurance broker, and that last word, broker, is key to this in that while we have agents that work for us, there are W-2 employees. As a company, we're a broker. We work with really every single insurance carrier that's out in the marketplace related to health insurance. And that's important because we have access to really everything that's available. And we, look at this as a kind of a holistic approach. So we do bring in all the different resources. There's unfortunately no one magic simple bullet solution, whatever you want to call it, to make health insurance super easy. We wish there were, but what we try to do is make this an easy process. But in what we do as a broker, we partner with really every carrier that's out there. We're not going to push one carrier over another. That's not in our best interest or your best interest. We're always going to be looking at this as a needs based solution, trying to figure out what is that perfect solution for you. And a lot of what we'll talk about today, you'll hear me mention this quite a few times, is choice. But when we start looking at the coverage options that we have as a company, we have individual health insurance for those that are under 65, typically individuals, families. That's coverage that you're going to have if you're not getting it through a business or if you're a sole proprietor, independent contractor, that kind of thing. We also have Medicare, and we have the various components of Medicare. So if you're looking at from a supplemental standpoint, so the A's, the B's, the D's, if you're in that range or getting close to Medicare age, those are terms you've probably either heard of or will need to understand. And then we also do Medicare Advantage, which is really, and we'll explain more about that, but they call that Medicare Part C, but we'll get into what the advantage of Medicare Advantage is versus a supplemental plan. We also have a full array of ancillary supplemental insurances, which are life, dental, vision. We have some non-insurance programs like our pharmacy solution. That's continuing to grow. And then if you're a business and you're looking for coverage for your employees, we have a number of different solutions related to that and be able to offer that. One thing that I will point out that is there is not right now the ability for us or anyone else on a national level to do what is called an association health plan. The association health plan, in essence, is a group plan that would be available to all the members at one set price. The reason for that, it's not us, it's actually, legislative and legal issue that's out in the market right now. They had brought forward with the last administration the ability to do an association health plan. And then about 13 states sued to stop that. And the reason that they sued was that the way the association health plans were set up is that they didn't have the built-in tenets of the ACA. So they could exclude for things like pre-existing conditions. Not that they would, but they could. They weren't required to have those elements that are within the ACA. Preventative medicine, women's health, mental health, things along those lines weren't a requirement. But it's also why those were advantageous for some people, because they were usually very inexpensive compared to some other insurance options. But again, you get what you pay for. The fact that they were less expensive really had to do with the fact is that they were kind of boiled down to the bare minimums as far as health coverage was concerned. Our overall goal is that if and when they do allow an association health plan to move forward, we're going to, as Christopher pointed out, IBPA is part of a larger group of book industry related associations, that we're going to pull all of the associations together, including all of the other ones that we work with that are outside of the book industry, and offer an association health plan that would be throughout our full array. The insurance companies like that kind of approach. We have, really great numbers when you look at that, and it would allow for some affordable prices. But again, it's usually bare bones or really significantly different. But it's only going to be part of our solution. We know that people want choice, and again, that's a word you're going to hear me talk a lot today. And people want to look at different options because everybody's needs a little bit different. Think about it like your car or your home insurance or renter's insurance. You pick it for a specific reason. If you talk to all your neighbors, you'll find that probably no one has the exact same plan you do. The reason is you bought what makes sense for you. Health insurance is sort of the same way. It can be the same way. It's not been necessarily done that way, but it can be now. That's what we're here to talk about today. Just because it makes sense. We do have our headquarters in Independence, Ohio. We were founded in 2009, just before the Affordable Care Act became a reality. And that's important because we grew up with that. And we've really, kind of gone way beyond what our founder and CEO, Jason Farrell, originally thought of when he started the company back in 2009. We are offering a full array of not just the ACA plans, but Medicare and the ancillary and the group plans that we've already mentioned. For our association partners, we have over 50 agents that work within our program. We can pull in more as need be. But these are our enrolling agents. These are our member services agents. So if you're enrolled with us in the past and you're looking to renew or change plans, you work with our member services team. But we have a very robust team of very professional, highly trained individuals who are here to work with you. Right now, we work with over 30 of the leading national carriers and a lot of local and regional, so depending on where you're at. One of the things that I do want to point out is that there are a few limitations, and these are set up actually because state rule applies when we're talking about under 65 health insurance. With a few exceptions right now, we're able to do every single state. Those exceptions would be New York State, Vermont, Massachusetts, Delaware, and Rhode Island, and Washington, D.C., not state, but Washington, D.C. The map up here, I have to update it, but we not originally, but in the last couple of years, there had been some changes in Minnesota and Washington state, which is why they're great out here. But they've actually come back to reality, and we're able to fully work within those states for health insurance on the under 65 set. Because it is state rule, rates are set with the states. The carriers themselves go right to the state regulators. The regulatory bodies establish what the rates can be. The carriers may ask for a large increase. The board in that state will say no, and they'll adjust it. But again, those rates and everything else are set with the state regulatory board. Also, they regulate who and what products can be sold, or who can sell products within their states. In some states like New York, they lock it down. Massachusetts does, absolutely. And it makes it either tough or difficult for an under 65 product to be sold by a broker. They want you going to their state exchange. So that's some little nuances that we try to work through. We are constantly looking at ways to either enact change or to either get around the systems or do things within the course of the legal ways of doing things, of course, to be able to help members that live in those particular geographic areas. Then it changes from year to year. Like I said, we just got Washington State and Minnesota back this year, and we're hoping that by the end of this year into next year, that we're going to be up to about 48 or 49 states. Massachusetts and New York, I think, are going to be the last two holdouts. They're always most difficult, and we just want to point that out. Medicare, no issues. It's a federal program. We're set up and able to do that in all 50 states. Same thing with our group, and most of our ancillary products are nationwide. So if we're looking at a group plan, again, defining that group plan as a business solution for a specific business and their employees, not an association health plan, because again, those are something that we can't do. But when you look at those product portfolios that we talked about, you have some points here that we'll get into more detail on. But these are some of those elements that we really look at as the key indicators. One of the other things that again, I'll emphasize today is that this is about choice, but this is also a member benefit program, and we're putting together the resources to make this not just an easy thing for you to be able to access or to utilize as a member, or if you're a potential member, to be able to then access these programs when you join IBPA. So we're going to talk about now in this next section, the coverage options, real coverage options, what's available today and into 2023. We're going to start with what is either referred to as Obamacare or the ACA plans, ACA being the Affordable Care Act. These plans are typically used by individuals and families where they are not getting coverage through an employer. This is real health insurance. It's carriers that you're very familiar with. Again, it's that ACA, Affordable Care Act, or Obamacare. There are different times that you can access ACA coverage. They have it that way because it is, from a standpoint of the carriers, once somebody joins, they start pulling people together into groups. It's nothing that you see or we see, but it's just how they do it to mitigate their risk, is they kind of spread out. So they do set it up so that you have an open enrollment season, which is what we're in the middle of right now, and actually getting very close to one of the first deadlines with the ACA plans. The ACA or Obamacare plans, the open enrollment period for that is November 1st through December 15th, if you want to have a plan in place for January 1. And normally those dates I just gave you are the typical open enrollment period, November 1 through December 15th. This year, they did extend it till January 15th. If you get coverage after December 15th, if you sign up for coverage, it will not start until February 1st. So you have two deadlines to take into account right now: is December 15th, January 15th. December 15th would get you coverage for January 1 effective date. January 15th would get you coverage for February 1st. If you do not get coverage, an ACA plan, through an open enrollment period, you do have a few ways to access this. Typically, it would be through what is called a QLE, or qualifying life event. Qualifying life event is really the way to access it outside of open enrollment. That would be, you've had a job change, either you've left a job, something's happened with the job, you've gotten married, divorced, birth of a child, adopted a child, become a naturalized U.S. citizen, you've moved. Those are some of the things, the main ones. There are a few others, but those are the main points that would allow you. Typically, you have 60 days once you have had that life change, that qualifying life event, in place to get or access a health insurance plan. You can do that through us. We are going to go through the marketplaces, go to direct to carrier. We have access, because of our relationships with carriers, to ACA plans that aren't necessarily on either the state or the federal exchanges. And that's where, we become really effective, is that we can look at all the options. And we'll talk about that as far as why, what we do is relevant, and why, working with us as opposed to doing it on your own is typically going to be a better option for you. But the idea here, again, is that you either access these through that open enrollment period or through a QLE. The benefits of an ACA plan at the end of the day are, a lot of the reasons they even started this in the first place is that these have to cover you for pre-existing conditions. You're never going to pay more for a pre-existing if you have a pre-existing condition. If you get sick while you have an ACA plan, you're never going to pay more after that happens. So if you've had like cancer or have had a heart condition, heart attack, something along those lines, before, during, or after while you're on an ACA plan, your prices aren't going to change. The only thing that really affects your pricing is A, where you live at, and B, your age. Some states, because again, this is state rule, even within the federal program, they may look at smoking as one other element that may change your pricing. Not every state or locale does that, but that can impact your pricing at times. Those are the only things that will change your pricing. For individual plans. Families, it's really the same parameters, ages of everyone that's being covered, where you live at, and health considerations is not part of this conversation. We'll ask you about that when we talk to you, but that's more to make sure that we're getting the appropriate plan, and that if you're going to the doctor a lot, one of the things we want to look at with you is what your out-of-pocket exposure is going to be, because if you're going to the doctor a lot, you don't want to have to pay a lot with a deductible or a copay. So those are things that we can look at, and we can be effective in seeing what your options are when you're out there. A lot of people, the other element on this is that they have subsidies that are available. And subsidies really are a tax credit. Either take it at the beginning, basically on a monthly basis, or you take it at the end and you write it off on your taxes at the end of the year if you qualify. We're going to get into more on the subsidies because there's been some significant changes there in the last year or so. So stay tuned for that here in a few slides. But that in itself is kind of unique. So I wanted to separate that out and talk about that on a separate slide. But for most people, an ACA plan can be very much the plan that makes the most sense for them, and that has to do with the guaranteed coverage elements, the fact that you're not going to pay more for a plan, or if you've had pre-existing conditions that you have to worry about that, and also the price, the subsidy components of those. The next element, these are all what we're talking about right now, are what you would call major medical plans. These are, accident, doctor, those type of things. These are all under 65 right now that we're talking about. The next plan that we look at, this is available in most states, like this is a plan, this what they call short term, isn't available in New York State, for example. They've locked it down that much that they don't even let these types of plans in the state. Nothing wrong with them, but these are basically an alternative to an ACA plan. This is more like what it was before the ACA. These plans are done, they call them short term. The name's slightly misleading, but they call them short term because you can do them for usually 3, 6, 9, or 12-month increments. We use these a lot, that if somebody has had something happen, or they don't have health coverage and they maybe miss their qualifying life event window, that 60-day thing that I talked about, that we will use these as a bridge to get you from whatever point in the year to when the ACA plan would kick in for you, say during open enrollment. So a lot of times we use these as a bridge plan, but for a lot of people, these actually can be a very good long-term solution. Most of the plans, you can use them for up to 3 years. You renew every year, and then at that third year, you would move into a different plan. But the big thing that you need to know on these is that these are medically underwritten. So that's probably the big difference between these plans and the ACA plans, is that they do look at your health scenario. If you have a pre-existing condition, again, cancer, heart condition, diabetes, these would not be a solution for you because they're not going to cover you for those types of things. These are medically underwritten. So that's where, when we have a conversation, when you're talking to one of our licensed agents, we are going to ask you some of these health questions, and it'll help determine, is this an option for you? Is this something that we'd want to take a look at? There's a few other things that we would talk about that would help us determine, is this an option versus, say, an ACA plan. But just to let you know that, with the under 65, there are these 2 options that we look at. There is a third option in the under 65 that we can use, and there's both an individual and a group element to it. It's called a MEC plan. Did not have a slide for that per se, because for me, I look at it as it's kind of a last ditch plan, but MEC stands for minimal essential coverage. Pretty basic, and the name says it all, is that it's the bare minimum. It's kind of a last ditch as far as I'm concerned. If you don't qualify for any other coverages, it is basic coverage. It's going to cover you for those emergencies. Normally, it is considered ACA compliant. Doesn't mean that it has to follow all the rules of ACA, but they will work as far as ACA compliant plans in most states, most locations. But again, what we typically look at as starting point are ACA plans in what are called these short-term options. There is that third element of a MEC plan. And again, for me, that is really what I would see for someone as a last ditch if there's no other alternatives out there, or if you're looking for just basic insurance, you don't go to the doctor very often. The next element of major medical is the plans for those that are 65 and over, Medicare. And we probably all heard it. I included two different words on this on purpose, Medicare and Medicaid. The reason I did that, and I also broke it out color-wise two different ways here, is that a lot of people do use these words interchangeably. They really are very different. And that's why I don't want to confuse the facts here, but I also want to call out the fact that these are very distinctly different. And what we're talking about here today is Medicare. But just to give you a head or kind of a quick overview on Medicaid, Medicaid is free health insurance. It's meant for people that really, from a financial standpoint, need help. It's going to be low income people that are, families, pregnant women, children, elderly. And again, elderly, they could potentially qualify for Medicare, but Medicare does have some cost, Medicare has some cost. But if you're in that dire of a financial situation, as an elderly person, you may qualify for Medicaid. And again, that's something that, if you're in that boat, which we typically don't see that with any of our association partners, but it does happen from time to time, we will forward you or get you to the right place. But these are done through the states, wherever you live at, Medicaid. And that's, if you need that kind of help, we'll make sure that we get you over the right resources and advise you, but we cannot enroll in Medicaid. So back to what we're talking about, which is Medicare. Medicare is health insurance for those that are 65 and over. Even if you have a traditional health plan through an employer, if you're working and you have an employer health plan, you still, when you turn 65, you still want to sign up for the original Medicare, which is parts A and B. If you don't, you can see some potential, they call it penalties, but basically you're going to be paying a fee or a penalty later on if you don't do that at age 65. It's one of those things that our team here, our licensed agents, can advise you on, what you need to do. But basically, once you turn 64, you're going to get inundated with information about Medicare. You don't really have to start doing too much until you turn about 64 and a half. And that's some things that our team here can walk you through if you have questions, but you do that initial enrollment through Social Security, and it's pretty basic, and it's not even really enrollment. You're just, signing up, and then you need to actually go in when you are right around the point of turning 65 to actually pick the Medicare plan that you would like to have going forward. As I mentioned, there's really two avenues you can go. There's the supplemental aspects of Medicare, which are the A's, the B's, the D's, and similar. A and B is your hospital and doctor. D is your prescription drug coverage. There's a few others that'll fill in the gaps, and there are plans called Medigap plans that are designed to fill in those things that you would normally want to see in a health plan that you aren't going to get from an A and a B, and maybe long-term health care, some of the other, PT and other things that you would need that you aren't going to get with A, B, or D, for example. Then you have, and that supplemental plan can work really well for most people. You also have a newer program or a newer way to handle Medicare, and it's called Medicare Advantage. And the advantage to Medicare Advantage is that basically the insurance companies have packaged together all the various parts of Medicare, the A's, the B's, the D's, the F's, the G's, all of that into one package. It looks and feels just like a normal health insurance plan that you had when you were under 65. It functions like that. The big difference is that these typically, the Advantage plans are HMO, meaning that if you live in the same area all year long, you go, you have a defined doctor network, hospital network, that's going to work really, really well for you. So that's where having, again, a conversation with our team, we'll be able to talk to you about it. If you travel a lot, like one of our associations that we work with is the Family Motor Coach Association. A lot of their members do RVing full time. Medicare Advantage plans don't work for those individuals because they really are, you get your maximum coverage where you live at or where your home address is at. So if you need to see your general practitioner, you need to do that in your home area. You can have full medical if you have an emergency. That's not an issue, but to do other things, any kind of treatments or any types of testing, things like that, you have to be in your home network on an Advantage plan. Many of the Medicare supplemental plans can be something that is used across the country. It doesn't have the same restrictions because it's not really an HMO type network. It's more of a PPO type of approach. And that's where, again, we have a conversation with you that needs analysis to understand what is the better solution for you with your Medicare today and long term. And even, looking at it from year to year, things change, doctor networks change, prescription drugs change. We'll talk about that here in a moment as well. Kind of like what I said with these subsidies on the ACA plans, with some of the things that have changed in the last year or two. But again, this is where our team can help you here and get you some of the answers that you have. The last major medical plan that we want to talk about is really employer coverage. This is an employer sponsored plans that you would have within a business for your employees. We really have two options. I did mention that third, which was that MEC plan. And again, that's very bare bones. And it's, to me, that last ditch type of approach. But for our conversation today, we're going to be looking at what is traditional group health plans. Everybody kind of knows that as the business picks a plan, Blue Cross or Humana or Cigna or something along those lines, and the employees all have the same health plan. The business tries to pick a plan based on the fact that most of the employees, doctors and hospitals and prescription drugs are going to be covered, but they really can't control that. There's some elements too, like the rates and other things that are not necessarily something that you can control easily as far as the business is concerned. It is typically group rated. So if one employee gets really sick one year or a couple employees, the next year you can see a rate increase because it is group rated, and that can impact not just those couple employees, but everybody in the plan. Same thing if you have numbers, like if you look at how many people are on the plan. Most traditional group health plans start with at least 2 W-2 employees. Some of the plans, if you fall underneath a certain threshold of employees participating in your group health plans, they will penalize you and you'll see some rate increases the next year. And that's why I'm really bullish about the alternative to traditional group plan, which is the HRA. And HRA stands for Health Reimbursement Arrangement. And at the end of the day, we have 2 flavors of those, as they were, an ICHRA and a QSERA. They're very similar. They're done a little differently. We typically look at the ICHRA as the model we go with, but this is, kind of the opposite of the one size fits all approach. Here, the insurance is done at the back end. So it's actually done at the employee level. The employees are actually getting individual health plans. The business is out of the business of insurance. They don't have to deal with it anymore. They don't have to worry about rate increases every year, picking a health insurance provider. That part's gone. It's about the financials at that point. Just like you do with a traditional group plan, you're helping to offset the cost of your health insurance for your employees. And that's the same approach that happens here with an ICHRA as it does with the traditional group plan, just done slightly different. And so for us, when we sit down, it's kind of that needs analysis again to understand, your business, your needs, what you're doing today. Are you offering coverage? How many employees do you have? Do you live in a state that, a lot of states are 50 or over, like really 51 employees and over? You have to legally offer health insurance to your employees. So other states have some different numbers, but the idea is that we look at where you live at, where your employees live at. If you're spread out all over the country, which has happened a lot since COVID, a lot of times the HRA models, that ICHRA, is going to be maybe a better alternative because it actually is based, the insurance is based where the employee lives at, not where the business is located, which is really the opposite of the traditional group plan. But again, that's where we come in with the needs analysis and really understanding what you're trying to accomplish. Are you trying to look at offering a plan for the first time because you're running into some roadblocks with recruitment and retention because you're not offering a plan? We hear a lot of that. And so, understanding kind of where you're at will help us really get to that point of what is going to be the better. We can quote both. We can look at both options and do a side-by-side comparison. We can do a side-by-side comparison as best as possible with your existing health plans if you're offering that. And we can do these. It's, a no cost. There's no cost, no obligation to go through the process of getting quoted. Same thing for, under 65 or Medicare. We do not charge for our services for individuals and families or to get quotes if you're a business. Now, if you're a business, there are some administrative costs. So, those go along with, the way the programs are designed, and we're very upfront about what that's all going to look like. But understand that you have two options when it comes to an employer-sponsored health plan for employees. The last area that we want to talk about as far as real coverage, things that are really available today that we want to look at are coverages that are beyond that major medical. These would be supplemental or ancillary, things like dental, vision, life insurance, critical illness, hospitalization. And why these are important is that most of the things that you would look at with a dental plan, for example, aren't going to be in your major medical plan. Not everybody understands that at times, but let's put it in this perspective. If you got into an auto accident, something happened with your jaw and teeth, that all would be covered underneath your major medical plan. But you have a filling that needs to be done, crown, cavity, root canal, whatever, braces, teeth cleaning, that actually is never going to be done under your major medical plan. That would be under a separate dental plan. So the dental plans, the vision plans and such are done to help further protect you financially, but also to get you the right coverage. Most of these, when you look at a dental and vision, like a major medical plan, are going to have preventative or wellness components to it, meaning annual teeth cleanings, eye exams, things along those lines that are done at, low cost or no cost, depending on the type of plan, just like you do with a major medical plan with things like your well person visits, physicals, colonoscopies. That same kind of stuff happens here. The other side of it is you look at things like critical illness and hospitalization policies and some of the disability type policies that are out there. Those are to help if something happens major. If you're hospitalized, these pay out lump sum monies to you, similar to, you've all heard or seen the commercials for Aflac. Very similar type of program. We do Aflac as well, but the idea here is that if you are hospitalized and you meet the requirements within the plan, you're going to see a lump sum dollar amount that comes back to you that you can use for anything to help offset lost wages or to pay your out-of-pocket medical expenses, deductibles, co-pays. Really, the money is anything. You can use it for anything. Go on vacation once you are healed. That is, again, all supplemental, and none of these are required. And as I'll probably say at least once or twice after this, we can do everything we have a la carte. So if you have a great major medical plan through a spouse and you're covered there, but you don't have vision or dental or life insurance, these critical illness hospitalization policies, everything we have can be done a la carte. You're not going to be required to buy one to get the other or something along those lines. But the idea for under 65 is that there's quite a few solutions there that we can look at to help regulate and offset some of the things that you don't have with the major medical plan. There are equivalents within the Medicare component, within the supplemental range, and also within the Advantage. You're also finding now with the Advantage plans, a lot of them are starting to build in some of these supplemental plans into their coverage, things like dental. That's kind of a new thing of late. Others are putting in things like gym memberships, silver sneakers, things along those lines. But this is where we can sit down with you and talk through your needs, that needs analysis to find out if a plan like this is a good thing to have in compilation with, say, your major medical plan. I said I would get back to some of the changes that have happened in the last year to 2 or 3 years. One of the biggest was subsidies. I mentioned earlier that within the Affordable Care Act, there is subsidies that are available to people that are based on financial need. Those can be used to offset the cost of your health insurance, the upfront cost, your premiums, not necessarily your out-of-pocket or your co-pays. And some people in the past, when the ACA or the Obamacare plans first came out, they looked at it, they found out that they didn't qualify for subsidies. They made too much money. The family size, it was, husband, wife, or, spouses, whatever, way you want to look at that, maybe some kids, but their total income made it so that they didn't qualify for subsidies. That was a known issue. And back when COVID first came out, we had the American Rescue Act plan of 2021, I think was the official name of it. But within that, they tried to fix the previous administration, some of the subsidy issues that happened out there. And what basically happened is they increased the amount of subsidies that were available to those that already received subsidies, which was a good thing. And they also extended the subsidies for people that in the past didn't qualify. So now they raised the ceiling. And so the dollar amount, family of 4, both working, maybe not qualified in the past, you may find that you do now. And what's happened there is in the past, it was also a cliff. If you made a certain dollar amount, or if one year you were qualified for subsidies and the next year somebody made more money, got a nice bonus or whatever, and you didn't qualify for the subsidy, at that point, that went away, and now you're paying full price for your health insurance. And it was literally a cliff. That's what they called it. So they went to more of a downhill approach. So you're going to find now that as your income rises, the dynamics of family, how many kids and husband, wife, spouses, all those types of things impact this where you live at as well, but it's still more of a gradual downhill. And that's good because it's going to allow more people to have access to subsidies. And again, these are tax credits that you can either get upfront on a monthly basis, or you take it at the back end. If you're, for whatever reason, want to do that at the end of the year, you would get that back basically as a refund. But the idea is that there are subsidies available for a lot more people than ever in the past, and that can be a really good thing. We can go through those with you, find out if you're subsidy eligible for ACA plans. And that's something that just, is, a good long-term fix. Originally, these were set to expire at the end of this calendar year, and the current administration extended this for another 3 years. So right now it'll be 2023, 24, and 25. At some point, we feel that they'll actually write this into the law, because right now it's just an executive order, basically. But these should be permanent or become permanent at some point in the next 3 years. But if you've looked at this in the past, didn't think you qualified at this point, definitely time to take a look at these again, and we can walk you through that and find out if you're able to qualify. One of the other big changes I mentioned that I would bring up was prescription drug prices. Now, this is more along the lines of Medicare. Medicare prescription drug prices, like a lot of drug prices in general, have been kind of out of control. We've all heard the news stories about insulin being $200-300 a vial, which just is wrong any way you look at it. Within Medicare, they've set it up now that I think it caps out at $35. Now, I will say that we have a non-insurance program. It's not an insurance product, but it is a pharmacy solution, and it's not a discount program. It is, or a coupon, like GoodRx is really a coupon or a rebate. Here, it's a legitimate pharmacy, and we have within that pharmacy program is a diabetes program or diabetic program, and insulin in there. If you're a member, because it is a monthly subscription price to get into the pharmacy program, it's actually $19.88 a vial for insulin. So it's actually cheaper than Medicare. You can use it with your Medicare plans. It doesn't replace Medicare Part D, but it can also be used for under 65. So if you have a need, you're taking medications on a regular basis, you may want to take a look at it. Our team can talk you through some of that and find out is this something that's advantageous. We had one of our association executives not too long ago. We're spending over $1,000 a month on medications. They signed up for this program. They were able to bring it down to under $500 a month. They still maintain their Part D, but one of their drugs was brand new and wasn't part of like any of the generic programs or anything along those lines. So that was the one that they were still paying, fully out of pocket for. Wasn't even covered by Medicare per se. But all their other prescriptions were covered underneath this program. So they were getting them at no cost as part of that. There's 600 drugs that are within that program that we have here that are part of the formulary and are done at no cost. There's the maintenance drugs, which are like heart medications or something like that you take every month. There's the immediate needs, things like Z-Paks and amoxicillin. You actually just go to your local Walgreens or CVS or something like that, and you get it. You show them your card, they get it for you. You don't pay anything for it. Your others, the maintenance drugs, are done as a 3-month supply mail order. And then you have things like the diabetes program. They do also have an over-the-counter program for things like Tylenol and vitamins and things along those lines. But if you have questions on that, we can get into that. Now, back to that Medicare program, we feel that at some point they will pull that into the under 65 population as far as those price controls, but the starting point was within Medicare. The other big one was what they call family glitch. The family glitch is where an employer is offering health insurance to their employee, but not to any dependents or spouses or anything along those lines. In the past, the federal government would recognize that as that person, that family receiving an affordable health plan. Well, in essence, it was only the employee and not the employee's family. And they would go into, say, the ACA, and because someone in the family was receiving an affordable health plan, that excluded those individuals that weren't covered under the business's plan from getting their subsidies on the exchanges. That's something that was fixed back in September by this current administration. And that's going to allow, if that is a scenario that anyone's in, or if a business is in, that the employees, dependents, spouse, children, whatever, will now be able to go in many cases and get subsidized healthcare through the ACA. That's separate and not going to be impacted by whatever their coverage is through that, say, for the employee that's getting it. It's a little confusing at times, but if you have questions on that, or if that's a scenario that sounds familiar to you, please let us know. We can talk you through that. If it doesn't sound familiar to you, it probably means that you're not impacted by it. So I don't say ignore it, but just know that there are some solutions that happen, and we can kind of walk through that. So we've gone through what are the real choices. Again, if you have questions, there is that Q&A question box here within the Zoom platform. Feel free to type those in and we'll be able to answer those here at the end of today's presentation. Again, choice. We've talked about this. I will bring it up a few times today, but that's a big part of what this program is. The program is for members. It is a exclusive member benefit program. If you're on this and you're not a member but want to access the program, I'm sure Christopher can put up a link at some point to the the link to where you can join or look to become a member. If you are a current member of this program, you've received, I'm sure, a few emails from time to time about this program and the links for it, the phone numbers and things. But again, this is open to all current members. This is, as we pointed out, real insurance. This is not a discount program or a network plan or limited benefits. As I've also mentioned, there's no fees for a individual or family outside of the cost of the premiums, which is actually goes right to the carriers. We don't take that on our end. And so you're not going to pay for any of our services or fees related to that kind of stuff. Quotes. If you are a business, we're doing a quote for you, no cost there, but there are basically monthly and annual fees associated with that for administering the program. We do have coverage options available all year long. Depends on your situation, your need, and also when open enrollment is, as far as what's going to be available to you. But these plans, again, are going to be designed, not necessarily designed in the sense that we're going to pull something out of thin air for you, but we're going to look at all the plans that are available and match it to your health and financial situation, even lifestyle. So if you're traveling a lot, as I mentioned, the idea, though, is to make this easy. As I've mentioned, we partner with really every insurance carrier out in the marketplace. But if we're doing especially business solutions or like our pharmacy program, we're going to partner with other firms, other organizations within the health insurance space to make sure that we are getting the best benefit, the best membership program, member benefit program for you and the rest of the BIHIP members, or in particular IBPA members. But in the sense here, we're going to work with every carrier that's available. We are looking at, for a business, for example, if we're doing an ICRA or a QSERA product, we have specific TPAs, which are third-party administrators that we work with to make sure that these are done the right way, that all the tax forms are done and presented the right way. But these are things that, you need to know that we're, going to bring the right resources to this and make this the best possible solution. Again, choice. We work with really every carrier. The carriers you see on here, this is just a small section or selection of the carriers that are out in the marketplace that we work with. The idea, though, is that there's no one national carrier. Now, you have carriers like United Health or even Blue Cross that have a national presence or more or less a national presence, but in the case of like Blue Cross and Blue Shield, they're actually individual organizations that are dependent to states. So you have, Texas and Florida and Illinois and so on, that they are that organization works in that state. Now, if you have a plan with a Blue Cross plan and you're traveling, you're still going to access a Blue Cross network. There's that advantage to working within that Blue Cross network. But again, there's no one national carrier out there. And that's, again, these rates are set at the state level and it gets kind of convoluted. But, like anything else, we may not have a perfect system, but if you ever really seriously look into what happens in, say, Canada or Europe, they're having their problems too. Right now, we're seeing that there's a huge increase in England on private insurance. They're going the way we have, even though they have a nationalized program. People are buying into these type of individual plans like we have here, so that they can avoid or kind of go outside of the national system. Because again, nothing is perfect. But with our program here, we're compliant and licensed in all 50 states. When we have a state like a New York or a Massachusetts, for example, or Washington, D.C., obviously we are going to have to follow the rules that they've established to be able to work or be able to help a member that is living within that state. Really, the only thing that really gets impacted by that right now is under 65 coverage in a few of those states, as I mentioned. But that's stuff that we're constantly working on, either with the regulatory bodies or with carriers, to see what we can do to, either fix that or to, figure out a solution. The approach we take, as I mentioned, that needs analysis type of approach. It's a concierge approach. We're here to, work with you and find that best solution with our licensed agents, our W-2 employees. And coverage that we have starts with one individual and goes to unlimited lives. So, party of one to, company of 1,000 or more. That really doesn't matter here on our end. when we look at the coverage options, I'm not going to go through this whole slide again because we've talked a lot about that, but the individual and family and group coverage options, the major medical, the ancillary products, the solutions that we have are going to be based on your situation, health-wise, financial-wise, and even lifestyle, how you travel. These last two elements on here are the things I really want to stress. We make getting insurance a great member experience. Now, it might kind of seem funny to you, in saying that, but we get excited about health insurance here. We do this day in and day out, and that's the important thing to remember here. This is something we do day in and day out, and this is why working with us at LIG and within this program, yes, you could go to the state exchange or the federal exchange on your own. You're not going to have anybody helping you. You're not going to have access to all the products that are out there, especially some of the direct to carrier. You're not going to have access to short-term of Medicare. You're not going to have access to any of the ancillary products. So you're going to have to go to other places to get that all taken care of. We've put it all into one spot for you. We can do it all for you. Call with one of our licensed agents, just kicking the tires, 10, 15 minutes just to get some basic information, basic pricing. If we're going to go through and do a kind of a deeper dive, look at doctors and hospitals and networks, or go through and sign you up, that's about a 20 to 40 minute call. If you are doing this on your own, I guarantee, unless you're doing this a lot or have done it a lot, you're going to spend a lot more time. I like to think of it this way, is that I don't do my own taxes. It gives me just the cold sweats thinking about doing my own taxes. I don't do them for the simple reason is that I'm not an expert at it. And if I did it myself, I'd probably go to jail because I do them wrong. That's, kind of being slightly sarcastic, but at the end of the day, that's just not something that appeals to me. We are that same approach. We are licensed, we're trained, highly trained within our teams and our staff, just like an accountant or CPA would be, to be able to do something for you that in a lot of cases you might be able to do on your own, something like TurboTax, but a lot of times it's easier to go through and have somebody like your CPA or your accountant get that done for you. The other side of it is you're going to give us information. We're not going to do anything with it other than contact you. You're going to form fill with us. We're going to have phone calls. We're going to collect information. That is safe. We're not going to sell it. We're not going to remarket to it. We're not going to call you later on and try to sell you an extended car warranty or something along those lines. If you go out on the web right now and you look up health insurance on Google, I guarantee that the first 2 or 3 pages of any of those web pages that you find in search results aren't insurance companies. They're actually list brokers. You fill that information out, your phone's going to get blown up, your email is going to get blown up. We don't do that. We do occasionally get some leads from for other part of our business from some of those kind of things, but within what we do for our associations, that is never going to happen. When you utilize our services, come to us. Yes, we will call, we will leave some voicemails, we will send you some emails, but we're not going to go and blow up your phones or become a pain or sell your information. We've talked about this a bit already, so I'm not going to spend a ton of time on these, but from the employer standpoint, I know there are a number of business owners within the IBPA. I just want to stress this again, that, there's a lot of advantages with these programs that we have, the 2 main ones that we use, which are the traditional group plans, as well as the HRA approaches. There's tax benefits, there's the ability for choice, especially when you're looking at the ICRA or that HRA model. A lot of elements for your employees that they never would have been able to do on a traditional group health plan. We can slice and dice a lot differently with a ICRA program versus a traditional plan. If you have employees that live in multiple states, you have you can offer coverage actually to part-time as well as full-time, salary versus hourly. You can't do those kind of things with, or easily do that kind of stuff with a traditional group plan. So this is where we can walk through. An initial consultation typically is about 30 minutes. We're going to be able to get some basic information from you to you about the programs. If we're going to go through and look at doing either plan designs or quotes for you, we will send you a census. We'll get some information on your employees, because that's what we're going to need to then go into the deep dive on that, getting a quote for you and built out for you. But again, we try to make this an easy approach for you. It's the concierge approach, any way you look at it, for the businesses as it is for our individual members. There's the tax advantages for the employers, the tax advantages for the employees, a lot of control and a lot of choice elements for the employer and the employee that didn't exist. And this is especially relevant around that ICRA model, but has the look and feel of a traditional group plan without a lot of the pitfalls. And again, if you're looking for that, something that's a little different, offering something for the first time, not sure where to go, or you're getting, killed with rate increases, things along those lines, we can definitely look at the different options for you. If you are a member and you are going to look at getting a quote talking to us about a under 65 plan, a Medicare plan, or a business plan, you have access to a web page that is designed specifically for the IBPA members. That web page is typically your starting point. You've gotten emails from us as a member that have a phone number in it that you can use to call in direct and talk to an agent. Just know right now we're in open enrollment. If you utilize that number, our agents are swamped. People tend to wait till the last minute. We're getting up to, today is the 6th, so we have 11 days left in this open enrollment period for the January 1st effective date. So it's going to be very busy between now and the 15th. We still are taking appointments this week. Most of our agents will not have appointments available next week, which is that last week of open enrollment. Appointments will open back up after that 15th date for the next round of coverage, which will be for a February 1st start date. But if you're going to that page, you can use the phone number that's on there. There's also a form that you can fill out that's going to ask basic contact information, your first and last name, city, state, zip, your phone, your email, and then those questions that you see here on the slide. What kind of coverage are you looking for? Health coverage for you and your family, which is really that under 65, Medicare options, if you're a sole proprietor, independent contractor, or if you're looking for employer coverage. That is really what we were talking about with the group and the ICHRA models. Again, want to stress we don't do anything with the information that you filled out. We don't sell it, remarket with it, or anything along those lines. But you have, as a member, access to this. If you're not a member and this program is of interest to you, highly encourage you to join or look to join IBPA, and then we'd be able to help you look at the different options. I will say that there's no magic bullet out there. I mean, we are going to be able to find the best options, the most affordable options, be able to look at things like deductibles and co-pays, but we're not going to be able to find a $100 a month plan. It just doesn't exist out there. But at the same time, we are going to be able to look at your best options for your individual situation, your family situation, or your business solution, and come up with that best plan, that best plan design to make this advantageous and to find the best solutions for you. And again, if you find that, or we find, if you have your current coverage that you're in the best possible scenario already, we're going to tell you. We're not going to try to flip you out of a plan just to get a sale. That's not how we do business. It's not how we have it set up with our association partners. And we wouldn't have the long-term relationships like we do with our associations and our association partners if we did those types of things. With that, I am going to throw it back to Christopher and to Nora and to you all, that if you have questions, I see that there's been some that have popped up. We'll be happy to answer any of those for you. I did throw here on the screen my direct contact information. If there's a question that you have that you're not sure about, you didn't want to ask here in a public forum, or just not even sure where to go with it, feel free to give me a call. That's my office number. You can also send me an email at tmcnichols, which is TMCNICHOLS at LIG Solutions, all one word, .com. And with that said, I will see if we have questions. Or Christopher, is there anything that I missed that you'd like me to touch on?
Well, first, thank you. I mean, that's a lot of information, so I really appreciate it. It's just health insurance can be kind of complicated, but you did a good job of explaining it as an overview, so thank you.
Yep, thank you.
So Charlotte wanted to see if you have any information about discounts for wellness practices like gym membership, physical training data, stuff like that.
Yeah, we do. And I don't think that we've put it up on the IBPA website yet, but that's some of the elements that we're starting to add into the program. So we do have some of those that are out there, some of the wellness programs that are available. And I'll look at getting that up onto the website here in the next week or so. But we can give you some of that information and have it on the IBPA webpage that you would access to get access for this program.
Yeah, and you mentioned, there are these specific enrollment periods. So let's say in July, if someone comes across this, is it still worthwhile, reaching out to you all at other times of the year, I guess, just to get information about when they can then enroll?
Yeah, I mean, as I mentioned, there are plans available at any time of the year. So it's really dependent. Like if there was a reason that in July they needed health insurance, maybe they've never had it before, we do have some options that we can look at. If they've just never had insurance and now they want it, we can, look and see what the options are and, walk them through that. If they've had some type of life-changing event, that qualifying life event, we can then go through it. Sometimes it's the business, they're looking, hey, we've just gotten to the point where, hey, we're trying to hire somebody and they turned us down because we weren't offering a health insurance benefit, which we've, especially a lot of smaller businesses, that's been something that, we've seen a lot of, or had a lot of conversations, especially because of COVID, as people were making a lot of job changes, they found that, somebody that wasn't offering health insurance, either people were leaving because of that, or they weren't coming on to take a job with that company because they weren't offering benefits. And so, that's something that we've been doing a lot of. So yeah, there's definitely benefits to talking to us at any time of the year to see what your options are if you need health insurance, or if you're just trying to look. Now, if you come to us in July and you're like, well, what are my rates going to be for 2024? Like if you come to us in July of 2023, they don't release rates for that 2024 year until typically sometime in October. So we could give you a ballpark, but we're not going to be able to quote you on a 2024 plan in July. If that
Yeah,
makes
and
sense.
that was going to be my question, because sometimes, it's good that people are trying to check in with you all, because you do get very busy when open enrollment happens. So I was going to ask then, like, if for those people who don't want to get caught in that rush, I mean, so is October then a good time to kind of start the process so you don't get hit with the rush?
Yeah, and I would say the rush really starts happening, like, open enrollment is normally in a normal year. And things were a little different during COVID, but we had more or less a normal year this year, but they did extend the open enrollment. But with that said, normally open enrollment's November 1st through December 15th for under 65 coverage. The rush typically is the last, kind of the last week of the month of November, just because for whatever reason, everybody always it's the end of the month, I got to do something. And then really those first 2 weeks of December. The early part of November, that's actually one of the best times if you're looking for a 2024 plan for individual coverage. Now, business is done a little different. That can be done at any time of the year. There's no open enrollment period per se on business solutions. Medicare is really dependent on what your scenario is. If you're, turning 65, there's actually a whole, like time frame for when you can do things, a few months before, a few months after, but you have a definite time frame right around your birthday when you can start doing things. If you're currently 65, you still have to follow that open enrollment period for Medicare. Medicare open enrollment is October 15th through December 7th. So we have one more day of Medicare open enrollment. So if you're looking for Medicare coverage, you got today and tomorrow to get that done. Otherwise, you're stuck with your plan, basically. Now, there is something in January and February where you can, if you have existing Medicare plans, you're currently enrolled in Medicare, you can change plans in January and February, but you can't enroll if you don't have a current plan at that point. And you don't have that birth date component happening.
Yeah. Well, again, this was such great information. I highly recommend our members, people who are non-members, signing up to really be able to take advantage of this, because like Tim was mentioning, it can be quite overwhelming. I certainly have done the research on my own in the past, and you just feel like, am I seeing everything? No matter where you look, you're like, okay, I guess this seems like an okay plan. But if you don't have that comparison, it can be quite difficult to feel like you're getting the best options. So take advantage of this benefit. So thank you, Tim, and thank you, Nora, for all the work you all do.
Yeah,
And
appreciate it. Thank you for having us. And again, I know a lot of people watch this on demand. Obviously we talked about a lot of dates that are specific here, but to your point, Christopher, these things can be done, a lot of solutions at any time of the year. So if you're watching this and it's outside of, the end of 2022 here, don't feel like you've missed the boat. Just, reach out. If you're a member, you have access through the IBPA website in your members only area, I believe, Christopher, is that correct?
yeah.
Yeah, and with the various emails that get sent out to members on more or less a quarterly basis, we try not to overload you guys. So again, appreciate everybody's time, and thank you very much. And for those that are watching this now or live, happy holidays.
Yeah. Thank you.
Thanks, everybody.